It's common for babies to have hiccups, and it's usually nothing to worry about. Hiccuping is a normal reflex and can happen even when they were in the womb. Hiccuping is one of the first habits your baby will develop. It's actually essential for their brain and breathing development. Babies, like adults, have no control over their hiccuping. It's a reflex that happens when the diaphragm causes a quick opening and closing of the vocal cords. This usually occurs when they're eating, drinking, or dealing with stressful events. It's common for newborns to hiccup quite often, and it can actually be a sign that your baby is healthy and developing well. Babies don't usually mind having hiccups and can still eat and sleep with them. They usually go away on their own within 5 to 10 minutes, so treatment is not usually needed. However, if you're worried about your baby's hiccups, there are some things you can do to help stop them or prevent them. Burp your baby during feeding to help relieve excess gas. Slow down the feeding to reduce the chances of hiccups. Feed your baby before they get too hungry to prevent upset feeding. Hold your baby upright after feeding to help with digestion. Make sure the bottle nipple is completely full of milk and the right size for your baby if you're bottle feeding. Make sure your baby has a good latch if you're breastfeeding. See a doctor if your baby's hiccups don't stop or if they look uncomfortable. Be careful with home remedies and make sure they are safe for your baby. Most of the time, hiccups are normal and don't cause any harm to your baby. If your baby has hiccups for a long time, it usually means they need to be seated upright during or after feeding, or that feeding needs to be slower for them. If your baby seems to be in pain or if the hiccups don't stop for many hours, it's best to seek medical help.